Hi there, thank you very much for coming in on our training day and allowing me to perform a head-to-toe exam on you as part of my training course. I just want to introduce myself. My name is Nurse Rose. If there is anything you do need to ask or you have any concerns, do just let me know. I would like to start just by confirming your name and date of birth. Perfect, and if I can just check your wrist tag. That's fantastic. Can you tell me what year it is? And what month are we in? Okay, lovely. Now you will have to forgive me. There may be times I do refer back to my course sheets. Like I said, I am in training, but I am doing my best. So I can confirm that the patient is alert and oriented ×3. They have confirmed their person and the time. So I just want to do a brief health history with you. So do you have any medical diagnoses? Have you had any surgeries at all? Okay, do you take any medications? Do you have any allergies? Are you taking any supplements? Do you smoke and or drink? Which one? How's your diet? Okay. And do you exercise? And how many times a week would you say? Now I can see that you have had your temperature and your blood pressure taken prior to you having a blood test carried out. Okay, so we just need to test your, excuse me, take your pulse and check your resting heart rate, okay? So if you just allow me to feel your wrist. Okay, I'm just going to feel the other. Okay. And then using a stethoscope, I'm just going to have a listen to your heart rate here. Alright, so now we have got your vitals out the way. We are going to begin the head-to-toe examination, which we will begin just by testing your capillary refill. So if you can pop your hands out like this for me, I'm just going to squeeze on your fingertips, okay? all good there. Then I'm just going to take a little look over your skin. I should have confirmed, and I do apologise. Are you okay with me just using ungloved, sanitised hands, or would you prefer that I do wear gloves? You're okay with the sanitised hands? Okay, so I'm just going to continue having a look over at the skin. I can see you do have some freckles and moles. Do you have any history of skin cancer at all? Okay. The skin is warm to touch. Okay. Do you have any itchy areas, any redness that comes up, or any broken skin with like weeping? No? Do you suffer with any skin disorders like eczema or psoriasis? No, you're all good there? Okay. Okay, so I am just going to check your muscle symmetry. Yeah, muscle symmetry here. You don't need to flex, I'm just feeling down the arm. Yep, everything's good. And now I am going to test the brachial pulse just on the inner crook of your elbow. Yep, so we're testing that for symmetry. Okay, then we're going to check the radial pulse in your wrists again for symmetry. Fantastic. To sign off this section here. I'm now going to test your strength and range of motion. So what I just want to start by doing is, if you can just grab my fingers and squeeze. Perfect. Then if you can place your hands like this, I'm going to place mine inside and try to stop me from pushing out. Then we swap, so you push out. Good. And I'm going to do the same with your knees as well. So I'm just going to push. Okay, then we swap and you push out. Okay, and then your ankles as well. So I'm just going to come down here and I'm going to push out. Swap. That's perfect. Was there any pain at all when we were doing that? Okay. Do you have any problems with mobility or moving around? Alright. Can you do a circular motion with your wrist? Can you do the opposite way? Okay. Can you do the same with your feet? So circular motion, and then the other way. Can you point your toes down to the floor? Okay, and then flex your feet, so point them towards you. Good. Okay, I'm just going to take a little look at your face now, so I am going to just check facial symmetry. So everything is looking pretty symmetrical to me. Okay, just going to have a little look in your scalp. If you can just pop your head down for me. I'm just making parts with my fingers. Do you suffer with a dry scalp at all? So any dandruff? No. There is no evidence of any dandruff, psoriasis, any nits. Okay, you can pop your head up again now. Okay, so now I'm going to test cranial nerve 5 and 7. I'm going to place my fingers just on either side of your jaw, and I need you to clench for me. Okay, that's great. Can you smile? Can you puff out your cheeks? Can you raise your eyebrows? Can you close your eyes really tightly shut? Okay. I'm now just going to do a sensory test, so I'm going to ask you to close your eyes, and I am going to touch you, and I need you to tell me where I am touching you. Okay, so we're going to move off the face now and onto the body. Great. So your cranial nerves 5 and 7 are intact, all okay. We are now going to test cranial nerves 3, 4 and 6, which will mean we need to begin by having a little look at your eyes. So I'm just going to hold a hand in the centre of your face and just check pupil dilation. Okay, now can I ask you to look just straight ahead at me? You can look at my nose. Yeah? Okay. Okay, I'm just going to have a look at the lower of your eyes. Sclera is white. We know your pupils are accommodating to light. Now what I'm going to ask is you go between looking at my pen light and the wall. So pen light, pen light, pen light, wall. Good. Pupils are also accommodating to distance as well. Can you follow my pen light with your eyes? Do not use your head, just your eyes, okay? Super. And then we are going to just have a little look at your cerebellar function. So I need you to go from touching my pen to touching your nose. So it'll be like, okay? That's fantastic. Okay. Can you make okay signs with both your hands? And then can you touch each of your fingers and do it backwards as well, just like I am? And then can you do it as fast as you possibly can? Yeah. That's great. Can you place your hands on your thighs? And then I need you to just flip your hands like so. Yeah. That's good. Okay. We're now going to do the cranial nerve 1, which is the olfactory nerve. So I'm going to ask you to close your eyes for me. Perfect. Can you smell this? What does that smell like to you? Good. Okay. I'm now going to be touching your face, so I will be palpating your sinuses. Okay. Is there any tenderness there at all? No? Okay. I do want to take a quick look just up your nostrils to ensure that your nose is nice and healthy. If you can just tip your head back slightly for me. Okay, no signs of polyps or deviation. I will just take a quick peek in your ears as well. Seems good. No excessive wax build-up. And then I will just ask you to open your mouth and say, ah. Thank you. Okay, so I can see you have your tonsils. They don't look enlarged in any way. General oral hygiene seems good. Good. Gums are a nice pink colour, nothing inflamed. Okay. I'm just going to feel your neck here, and I would like you to hum. Okay, so keep going for me. Superstar. Well done. Okay, now cranial nerve 11. Can you shrug your shoulders up and down for me? Okay, can you rotate your arms? Any pain? Good. Okay, that's fine. I'm just going to fill your lymph nodes here. Can you shrug your shoulders again for me and hold it? Okay, you can relax now. Okay, I'm just going to take a little look at your neck here. Could you swallow for me? That's all good. Okay. Now, would you be able to turn around so your back is facing me? Thank you. Okay, so I'm just going to take a little look over your back here. Again, I can note that you do have some freckles and moles. None of them seem to be concerning. Have you visited a dermatologist at all? Yeah, it's always beneficial that you can do a full body scan, just because you do have quite a few freckles and moles. It's always worth it. Could you just bend forward for me? And if you can hold there, I'm just going to feel down your spine. Okay, if you'd just like to come up slowly. Don't want to give you a head rush. Can you breathe in and out for me? Okay, breathe like a couple of nice, really deep breaths in and out. Okay, I'm just going to percuss your lungs here. Listen to your back with the stethoscope as well. So if you can continue doing those deep breaths in and out for me. You. Would you be able to just turn and lay on the bed? Thank you. If you can start just by laying completely flat and then moving your head left to right. Is there any pain in the neck at all? Okay. I do just want to inspect your chest here. Could you take a couple of those nice exaggerated breaths again for me? I just want to make sure we have equal chest movement. Good. And now I'm just going to have a listen to your heart valves. Okay. And now I'm just going to percuss your abdomen. If there is anything that is extremely uncomfortable or painful, do let me know, okay? Pain at all? Okay. So now we've done the percussions, I am just going to palpate. This can be a little tender because we do tend to push quite hard, so okay. Okay, right. Just going to finish off by having a little listen to your stomach, okay? Okay, so normal bowel sounds in each quadrant. If you just want to sit up for me. Okay, so how are you feeling?
Miss Rose.
Just give me one moment. Excuse me, how are you feeling? Yeah? We can go over your blood results in just a minute.
Rose. How long have you been having these visions?
It's just